Hello, I'm Janine Kakmar with PHTV Channel 4, Palos Heights, with our show Healthcare Experts in Your Corner. And today we're here with Sarah Baranowski. She's the Director of Rehabilitation Services at Palos Health, or Palos Hospital, as many of us know in town. And so, Sarah, thanks for being with us today.
Thanks for the invitation.
Sarah's here to tell us there's so many things that go on in the community we were just talking about. And one of the reasons we have this show is to let people know all the different resources that are available in the community. So I'd love to hear about the different resources that go on at the Palos Health with your I can't say that word today. Rehabilitation Services Department.
Well, that's a perfect segue. One of the services we have is speech pathology for those who have challenges communicating. But we also have occupational therapy. We have physical therapy. We have an EMG program, which helps test the nerves throughout your body for people who are having any weakness or problems there. We also have a very robust wound care clinic. So patients who have wounds pretty much anywhere on their body, we can work to help heal those and get them back to recovery.
Now, are these services available for people who are just at the Palos Hospital, or?
No. So we have both inpatient services for the people who are in the hospital spending the night. We also have a very robust outpatient program. In fact, almost more of our services happen on an outpatient side than even on the inpatient side.
That's amazing. I didn't realize that.
Yes. And we, in rehabilitation even, we actually have 3 locations throughout the community. We have one in Orland Park at what we call our South Campus, and then we also have a Women's Services Center in Tinley Park, and that's really part of a robust oncology program.
Okay. And so anybody living in the community can go to any of those for those services?
Absolutely. So whether you have a doctor that's part of Palos Health, or if you see any doctor really anywhere in the world, all you need is an order from them to join us, and we can absolutely provide that care.
Are there any specialty programs that you guys have at your center?
We do, and actually it's something really to be proud of within the community. We have a specialty aquatics program, so patients who actually need physical therapy but either struggle to do it on land. We have a pool, and it's a warm weather pool, so we have that. We have a full incontinence and pelvic floor program, so a lot of people think that it's normal to have that, but it's not, and so we have those specialty services. We have something called lymphedema. Those are patients who have circulatory issues. We have specialties in that.
Interesting.
We have really specialties in spine care, so low back pain. People who really have an expertise in that, and that's honestly just to name a few. There's really it's a one-stop shop really for any therapy needs.
What can you tell us about the staff or the rehabilitation team there at the hospital?
I think one thing that really sets us apart is those specialties. The staff goes back to school to get additional training, additional certifications. So outside of having either a bachelor's, master's, sometimes even doctoral level training, they are actually taking on that additional knowledge. And so I think that's huge. One of the other pieces about our team really is that all of our care is one-on-one. So when you come to one of our clinics, you will see one of those licensed therapists.
It's kind of nice to know that you'll be dealing with a specialist in the field. So when you're working on something, you know that it's something they know about.
Absolutely, and I think that it's something we take for granted because it's just inherent in our business, but there are a lot of other clinics out there that use aides or high school kids to help, and not that they're not kind or well-intentioned, but really to have somebody who's done the schooling, done the training, and to know they're 100% focused on you for the whole session, I think really makes us stand out.
Nice. What are the most common misperceptions about the hospital-based therapy programs?
I think really what I see is most people think that to come to the hospital you have to be sick. And you don't have to be sick to use the services. And in fact, one of the things that Palos is really committed to is helping people stay well. And so we work on a lot of prevention programs, but I think also even if something happens, it can be you broke your finger, it can be you sprain your ankle, it can really be you're having back pain. So I think people think hospital, they think, that's only for people who've had a stroke or maybe who have a very complex host of injuries, and we can help those patients and do on an everyday basis, but I think really realizing that the services are very robust and we can help a lot more people than that.
Okay. How does the patient care system work different from the other care models that are out there?
I think one of the things that we really work hard to do well is to be patient-centered in our care. So when people come to see us, their evaluation is completely individualized to them. So they'll even call and say, well, my doctor says I should come for 12 visits. But if we can be done in 10, then we're like, great, let's be done in 10. So I think we really try to get to know our patients. What do you like to do? Do you like to garden? Do you like to run? Do you like to swim? Dance with your grandkids, whatever you like to do. And I think we really tailor our evaluation and our goals to the patient, and then make sure we're setting up a plan that is centered around what they can do. So we don't want people to say, oh, well, I have to come 3 times a week. I can't make that work. If somebody says, I can only come once a week, okay, well, then we'll structure a plan that can meet your needs. If you can come more, great. If we can get you done sooner than planned, by all means. We want to get you back to doing what you're doing sooner, than normal. And I think that patient-centered nature really makes us stand out.
Yeah, it seems like it's more mentally just reassuring that, okay, it's not adding more stress to, I have to get there, I have to get this done, but you're working more on their schedule and that kind of thing.
Absolutely. And I think, too, just having their goals in mind. We don't have a cookie-cutter format that everybody's treatment looks exactly the same. My treatment, your treatment, anybody's treatment will be as tailored to what they like to do and what they're able to do.
So how would somebody who are interested in receiving care, how would they go about doing that?
Well, the best place to start is with your doctor, because we want to make sure that everything's been looked at, that we know what we're working with. We kind of liken our services to a prescription that you would get for medication. You're not going to go to the pharmacist and say, my doctor says that I should have this, antibiotic. You go to your doctor, they come up with an idea of what they think is wrong, then they refer you to us to follow through on it. So once we've had that referral from the physician, we pretty much take it from there. We have a whole support team that makes the appointments, works with the insurance companies, really takes everything over from there. All we need is that first step that the doctor says, yes, you're safe to get started, and then we take it from there.
Oh, that sounds good. So we were talking just a bit earlier about how active Palos Health is in the community. What are some of the other events you have coming up?
Yeah, so we have a diabetes fair coming in April, on April 21st, and it's an opportunity to hear speakers, cooking demonstrations. Our rehab team will be there as well to talk about how we can help people who have diabetes. Palos is the biggest sponsor of the Southwest Half Marathon, so I think a great example of the continuum of our services there, because diabetes people think illness, hospital problems, but we're also out there supporting runners and people actively out there walking, and so we'll have our therapists there doing stretching and recovery after the race. So we'll have teams there too. We also have a lot of fall prevention activities that are going out in the community.
You mentioned that. Yeah, talk a little bit about those.
Yeah, so falls are a huge issue that people don't even realize what an impact they can have, and once you fall, people lose their independence, they lose their autonomy at home. So we have programs called Matter of Balance that helps people really look at themselves, the psychology of it, the environment in which they live. And so we have training programs that happen at the hospital, but also then they can help refer to the rehab services for people who need them. So really we are equally or more focused not only on helping people who have a problem, but ideally helping prevent the
problems.
Right,
no, that's a whole range of things. Now, back to that diabetes fair, what day was that?
That's April 21st. It's in the morning, I believe, at 9 a.m. And again, there'll be speakers, there's cooking demonstrations, they'll have a lot of vendors there to learn.
I like the cooking demonstration idea. No, just, as part of healthy eating, healthy...
Absolutely. Yeah, and so we'll be there really everything from, what kind of shoes you should wear to how you should eat and
shoes
mindful
for diabetes?
eating. Yes,
really?
Because, preventing a wound, they can have circulation issues and problems. And so it's a great segue, obviously, to our wound care program, because many people who have diabetes have trouble with circulation. And so we want to help them have the right footwear, make sure they don't end up with a wound, and make sure that then, it also creates balance and stability, because if you're shuffling around in ill-fitting shoes, you can
those
fall.
High heels just aren't going to cut it.
Yeah, exactly. So there will be a lot of really great services there that.
And where's that at?
And it's actually at the hospital, so right here in our auditorium.
And it's
so close
open to everyone?
It's
Is
free.
it free?
Yeah,
Okay.
so you can register. You can call to the hospital, or I believe you can even register online. And
now, is the marathon signed? Is there a deadline for sign-ups for the marathon?
you know, I honestly don't know the answer
we
to that
better
one,
check
so
on
there
that
we go, more to learn.
Yeah.
But I do know we're a big sponsor, so we'll be part of the packet pickup and there to answer questions and help people, and then there afterwards too. And one of our therapists is running in it as well, so
Is that right?
she'll be waving and, you know, cheering everybody on.
I like the idea that they're going to be at the end of the
Yes,
end
we
of the
will be
finish line
there. We will be
for
there.
stretching and collapsing, whatever.
Yes, absolutely.
Right. So, but is there a place where we can go for information on the website?
Absolutely, yeah. You can go to paylesshealth.com, and there's information there about the whole scope of services we offer, the most common diagnoses that we treat, the type of clinicians that we have, all of our contact information. Really, it's a great resource all the way around to pretty much a one-stop shop for everything that you would need.
It sounds like it.
Yeah.
Wow.
And I think that's probably the neatest thing to know about our rehab programs is it really can be a one-stop shop for people. So they don't have to say, well, I have this problem or I have a different kind of problem. We can just say, well, come to us, because pretty much everything we have some expert that can cover.
And it seems like so many things are related to each other too, just like you said about the footwear and falling and, you know, whatever. I wouldn't care that, you know. So it's nice that they know that they can have it.
Yes.
If it's not one thing, you'll still be taken care of.
We will absolutely take care of it, and I think that is part of our commitment, kind of going back to that patient-centered care. We really do treat the whole patient, and so we're helping make sure they have the right resources, making sure we put them in touch with either community partners, other resources within the hospital, or physician resources, whatever the case may be. We really do want to be a partner in their healthcare.
Wonderful.
And kind of cover the whole thing.
Sounds great. Well, Sarah, thank you so much. For those of you who are listening and you missed out on something, you just came in and say, what was she talking about? You can go to their website again. What is the website?
It's paylesshealth.com.
And take a look at some of the things that Sarah was talking about. So thank you for joining us today, and we'll see you next time.